Hi there, my name is Joe Blasick and I am the owner of Blasick Insurance Services. I am your agent for all of your employee benefits offered through Arlington Urgent Care, and I wanted to take a minute today to discuss the differences between a traditional copay plan and an HSA plan. I know there's always a lot of confusion about what covers what, how is this covered, how is this not covered, and I want to kind of cut through that for you today and give you a quick video so that you'd have something to refer back to. So you should have been given a packet, handed a packet that kind of goes through all of your employee benefits. It has some benefit summaries, some key terms, some contact information, and a lot of dates to keep in mind. I would advise you to kind of hang on to that packet throughout the year and kind of refer back to it. It's definitely something nice to hang on to whenever you have questions about your plan. So if you have it, go ahead and pause the video and get that out. And if you don't, maybe pause the video and go grab it, and we'll actually dive into that and kind of go over some key terms here before we actually get into the plans. So I'm going to pull this up. All right, here's the front page of the packet. We're going to go down here to health insurance terms and definitions. We're only going to go over a couple of these. Most of these are pretty self-explanatory, but before we dive into the ins and outs of the actual plan designs themselves and what's different here, I'd like to take a minute to discuss the negotiated rate, or the contracted rate, as some people call it. So anytime that you have a doctor, a hospital, a facility, a pharmacy, any provider, as we call them, as you guys well know, working for an urgent care, anytime that you have a provider and they want to be in network with an insurance carrier, the insurance carriers come to the table and say, hey, if you'll accept a lower rate, whatever that rate may be, for each service, for each prescription drug, whatever, what have you, if you agree to this as payment in full, you can be considered in network and you can be in our network. So they go back and forth and they eventually agree on a rate that works for both of them. And then the doctor, hospital, facility, pharmacy, whatever it may be, is considered in network. So that's what that negotiated rate is. It's just a negotiated or a contracted rate between the provider and the insurance carrier for a given service. Now, how things are covered outside of that, that's kind of where we go into the differences here between an HSA and a traditional plan. So right above this in this sheet, you can see copays. All right, and it says right here, this is a set dollar amount you pay when you receive medical care from PCP, specialist, emergency room, urgent care, prescription drugs, so on and so forth. And it's called a copay because two people are paying, right? You take that negotiated rate that you have, that negotiated fee between the provider and the insurance carrier, and then two people pay. You pay, and the insurance carrier pays. So you pay a fee, whatever that may be. Let's just say it's a primary care physician. You pay $30, but that actual negotiated rate between the primary care physician and the insurance carrier is $130. So you'll pay a set $30 copay, but the insurance carrier will actually pick up $100 of that, so that the payment in full, that $130 that was negotiated, is paid in full to the provider. So that's why it's called a copay, because two people are paying. Thus, those copay plans typically cost a little bit more than some of the plans that don't have copays in them. Okay, so just kind of keep that in mind as we're going through here. Also, there's information about the health savings account itself. We'll get into that here in a second. So what I'm going to do, there's some more information down in here just about new hire waiting periods, open enrollment, plan changes during the year, when your benefits are terminated, and then just some helpful numbers, emails, so on and so forth here for you to refer back to. Okay, so now let's get into the differences in the plans here. This up here, as you can see, is the traditional copay plan. Why do we call it traditional? This is more or less what you're used to. It's a PPO plan, so there's in and out of network coverage. And when you go in for any kind of major surgery, you have a set deductible. In this case, it's a higher deductible of $5,000 for a single, $10,000 for a family. And after you've reached that for the year, say you have a $10,000 claim, you pay essentially $5,000 of that claim, and then your coinsurance kicks in. So after you pay $5,000, then Medical Mutual pays 100%, you pay 0% for the remainder of the year, and they pick up all other costs for things that would apply towards your deductible. Now, down here for general services, a lot of the services that are used the majority of the time, primary care physician, specialist, urgent care, emergency room, and prescription drugs, you can see there's set dollar amounts. So regardless of what that negotiated rate is between the doctor, the hospital, the urgent care, whatever it may be, the pharmacy, you know before you walk in the door, for an in-network provider, these are the amounts that you're going to pay. Now, while you know that these are the amounts that you're going to pay, you also know that over here, this is going to actually cost a little bit more than a plan without copays, right? Just because you have some initial cost sharing, regardless of whether you hit your deductible or not. Because all these copays, none of these apply towards your deductible. They apply towards your out-of-pocket maximum, but they do not ever apply towards this $5,000 deductible, okay? What does apply towards the $5,000 deductible with this type of plan? These types of services down here. An outpatient surgery, inpatient, any major diagnostics like I've listed here, CAT scan, PET scan, MRI, anything major like that that you would do in an outpatient facility. Sometimes you would do it in a doctor's office, maybe even an urgent care setting if they have those available. And then any kind of hospital newborn deliveries, any kind of major surgeries, anything like that. Under this type of plan, that's what would go towards your overall deductible, okay? So that's a brief overview of this. Keep in mind there's some service numbers down here. You can always call the number that's on your ID card first and foremost. You're not going to carry this packet around with you, but I just put these down here for your reference, okay? So let's go down to the HSA plan now. Now that we've kind of gone over the basics of the traditional plan, we can see the HSA plan actually has the same deductible. So $5,000 for a single, $10,000 for a family, same coinsurance. After you hit that $5,000 deductible for the year, Medical Mutual pays 100%. You pay 0% for the remainder of that year. Okay. Out-of-pocket maximum is $6,450 and $12,900, single and family. But in this plan, you can see that there are no copays. That's where an HSA plan differs. Based on these are built by the IRS. They have them filed a certain way for a very specific reason, which I'll get to here in a minute. But under these plans, there are no set copays. So it says 0% after the deductible for all of these, other than the prescription drugs, which we'll talk about in a second. But why is that like that? What does that mean? Basically, what that means is that you're going to pay when you go to the doctor, the specialist, the urgent care, or the emergency room, you are going to pay that negotiated rate, and it is going to apply towards your deductible until you've met your deductible for the year. And then you pay zero. Medical Mutual pays 100% after that. So everything on here, including prescription drugs up to the deductible, you pay at the negotiated rate. If you take a look down here as well, outpatient surgery, inpatient surgery, CAT scan, PET scan, MRI, newborn delivery, everything on here other than preventative services, everything on here you pay at the negotiated rate, and it applies towards your deductible. So every time you have, let's just say you have a $100 office visit and it goes towards your $5,000 deductible, now your deductible is now $4,900 for the rest of the year for any other services that you may get. Okay, so the one caveat to this plan, and before I jump into that, one thing you'll notice on both plans for preventative services, you pay $0. So I'll scroll back up here to this plan, the traditional copay plan as well. You pay $0 when you go in for preventative services. It doesn't matter which plan you have. That's Affordable Care Act language. We can't get away from that. So just know that, any well visits, any type of male or female exams that you may need or something like that are truly preventative in nature, those are covered at 100% no matter which plan you pick. Now, because there are no copays built into this, you can see that these rates are substantially less. It actually costs you less premium to have a plan like this because there is no immediate cost sharing. Medical Mutual doesn't pick anything up other than for preventative services until you've reached your deductible for the year. Now, after you've reached your deductible for the year, the one caveat to this plan is that some copays do kick in, but only after you've met that deductible. So there are some copays for prescription drugs, but again, that's only after you pay the negotiated rate for all those prescriptions, everything else, until you've met that deductible, okay? Now, this plan costs a little bit less. It actually costs quite a bit less than the traditional plan because of the lack of copays. But why is it called an HSA plan? It's called an HSA plan essentially because it is the IRS has deemed it HSA compatible. It's just a high deductible health plan that's met certain limits and certain standards that the IRS put in place so that you could open up a separate health savings account. So this plan itself is just a high deductible major medical plan. The HSA itself is a separate savings account that you can actually open up it's just like a true savings account that you have in your bank right now. You essentially just open it up and you can use the funds to pay for qualified medical expenses. That's all it is. Now, one thing I will say about the health savings account, you do not have to open one up. You do not have to contribute anything to it. But if you do want to contribute to it, the contributions are actually tax-free. So you can actually talk to Dr. Rankin, Molly, and Will, and they will actually help you set up pre-tax contributions out of your paycheck, every single paycheck, to go towards an HSA fund, which is really nice. So again, you can use it to pay for your medical expenses. You can actually use it to pay for dental, vision, any qualified medical expense that's on publication 502 in the IRS website. Okay. Also, on top of that, being able to open an account, anyone that chooses this plan this year, and this is actually listed right here. It's listed a couple times in this packet, but it's actually listed right here. Anyone that chooses to go on to the HSA plan this year, Arlington Urgent Care is actually going to contribute to your HSA account so that you can use that, the HSA funds immediately at the first of the year if you need to go in for something. Okay, they're actually going to contribute $500 for an employee only, for a single, and anybody else that chooses employee spouse, employee child or children, or family coverage, they're actually going to give you $1,000. So $500 for single, $1,000 for employee plus spouse, children, family coverage. Okay, which is very, very generous, and that is money that you can use right away if you need to. The goal is to keep it as a savings account if you can, let the money accrue over the years and use it when you need it. But it is there if you need it. And, it should cover a few office visits, which is really nice for you and any kids or any spouses that you may cover under the plan. So those are the plan designs themselves. Again, take a look at the rates. You can see the big rate discrepancy here. You're paying a lot more for copays per paycheck than you are for the lack of copays with an HSA. The deductibles are the same. So what does that really tell you? If you're going to really utilize the plan a lot, if you really need to utilize the plan a lot, or if you're barely going to use it at all, the HSA is probably the plan for you, just because you're going to pay less in premium for the same result. Versus if you're going to go to the doctor a decent amount of times, but you're really not going to have any major surgeries, anything like that. The traditional plan might be a better option for you. Not sure. You may just not want to give the insurance carriers that much more money, and you just want to hang on to that. So the HSA might be a better option for you just because it costs less, and you'll have a little bit of money in this health savings account from Arlington Urgent Care. So those are the plan designs. I've also mapped out just a few things here to help you kind of differentiate a little bit more. If we take a look at how are inpatient, outpatient, and like the different diagnostic procedures covered, just like I said in the benefit summaries above that we just talked about, both of these apply towards your deductible. It doesn't matter which plan you go to. That's why I'm saying if you're going to use the plan a lot or use it not very much at all, these plans operate very, very similar in terms of high utilization. So any major expense is going to apply towards your deductible, which are the exact same. And the coinsurance is the exact same for these plans. Here's where it really differs, as we talked about. Primary care physician, specialist, urgent care, emergency room, prescription drugs. Under the traditional copay plan, they are covered by a copay. You pay that set copay amount. It's a lower amount than negotiated rate, and it does not apply towards your deductible. Whereas with the HSA plan, you pay the full negotiated rate, and it does apply towards your deductible. It keeps bringing that deductible down as you kind of pay in. It's not a race to the deductible, but just know that the money that you're paying is actually applying to something, and it's applying to your deductible. Preventative services covered at 100% in both. And then am I able to contribute to the HSA under the traditional plan? No, due to IRS filings and guidelines. With the HSA compatible plan, yes, you can open up that HSA up to the federal limits. You can contribute to it if you'd like. And then again, Arlington Urgent Care is contributing $500 for a single and $1,000 for employee plus spouse or children or family. Okay. And down right below this, I've actually mapped out just some common claims, just showing exactly how this is broken down for each plan. I'm just going to give you one example here just to give you an idea. basically it says Joe had to go to a primary care physician. The negotiated rate between the doctor and MMO is $130. So under the traditional plan, out of that $130 negotiated rate, Joe is going to pay a $30 copay, all right? And then Medical Mutual is going to pay the other $100 of that $130. So together, Joe's $30 copay plus the Medical Mutual payment of $100 keeps that primary care physician whole. It basically pays him in full for that $130 rate that he had contracted with Medical Mutual, and they agreed on his payment in full. So that's essentially how that works. The $30 copay does not apply to Joe's deductible. All right. Under the HSA plan, since that negotiated rate is $130, that's exactly what Joe's paying towards his deductible. He's paying the bill for that $130 office visit, and once he pays it to the doctor, it's actually applying towards his deductible. So now his deductible is no longer $5,000; it's brought down $130 from that. Okay. Now, the nice thing is, if Joe has money in his HSA, which in this case you would, because Dr. Rankin's contributing $500 to a single, $1,000 to a family, you would have money in your HSA already to pay for this. So you could essentially pay for this with the money that you have from Dr. Rankin, or if you put money in on a tax-free basis, you're essentially paying for your services tax-free. I always make the joke to my wife, we have an HSA ourselves, and this is what I personally do. I have Medical Mutual, the same type of plan that you guys have, but I have an HSA. And when we knew that we got pregnant, we just put a ton of money into that HSA, kept doing it until we had the baby. And then I said, hey, we had a tax-free baby. We paid for the entire pregnancy, everything up to and afterwards, completely tax-free because we contributed to our HSA. So with that in mind, if you do want to make the switch to the HSA, let's go back up here to the key terms. And here's just a little bit of information about the HSA. So it just shows you the 2020 limits. You can contribute $3,550 for a single, $7,100 for a family. Unless you're 55 to 64, then you contribute an extra $1,000. If you're 65 or older, you are not able to contribute just because you are eligible for Medicare, and the government doesn't want you double dipping in that. So it's a true savings account. So the money goes in there. It's not a use or lose it. Like you've heard of FSAs, it's alphabet soup out there, but it's not a use it or lose it. It is use what you need when you have it, and you can't use it unless you have it in there. So it's just like the savings account that you have at home right now in your bank. This one's just used for qualified medical expenses, and that is it. So I hope that, I know that's a little lengthy of an explanation, but I hope that makes sense. I hope you guys have a better understanding of the differences between a traditional and an HSA type plan. If you're still confused and you want a little bit of help kind of deciding which route that you should go, please feel free to give me a call or give Becky in my office a call. We're both here to help. The number is listed in your packet, but just in case you want to write it down, it's 614-870-1775. Hit extension 1 for Becky, or you can hit extension 3 for me. Due to the time of year and everybody renewing at the same time, we are a little busy right now. So if you don't get a hold of us, please leave us a voicemail and we'll call you back as soon as we can. We just go by the voicemails that we get in. So please just leave a voicemail and we'll call you back as soon as we possibly can. All right. Thanks so much. And I'll talk to you soon. Take care.